Hello, I'm Stefan Tolan, one of the shoulder surgeons with Steadman Hawkins Clinic of the Carolinas, and I wanted to talk with you today while you're in the hospital about what to expect when you're discharged or when you're at home. You've recently undergone a shoulder replacement or maybe a reverse shoulder replacement, which again is a different type of total shoulder replacement, and are recuperating in the hospital and now are making plans towards discharge at home. Some of the questions that come up are at home, what to expect pain-wise, what to expect with physical therapy, what activities are you able to do, and what signs of problems are there to look for. As far as pain level when you're at home, really the plan is to keep it well controlled. Basically, we'd continue you on one of the pain pills that you were in the hospital where we've had a chance to see that it works for you, and we'll send you home with a prescription for these to take at home. Usually you'll be on pain medicine as you need it for a period of 1 to 2, maybe 3 weeks. In addition to the pain medicine that you're given, you can also take Tylenol as long as Tylenol is not in the pain medicine, and that's easy to check. Just look at the prescription bottle that you have, and if it says acetaminophen in it, which is Tylenol, then you can't add Tylenol on your own. If you're allowed to take anti-inflammatory medicines or non-steroidal such as Motrin or ibuprofen, those are also a good adjunct to add to the pain medicine or the Tylenol that you're given. Also, in the top of your shoulder, most of the time a pain block would have been placed by the anesthesiologist. This is designed to decrease the pain in the shoulder area or the operative site for a period of up to 48 hours. You'll be given contact information and some instructions on this while you're at home if there's an issue with it where you feel it's not working, that you can call and get some questions answered. You'll also be given instructions on how to remove this at home. It's simple to remove. It slides out almost just like the IV that they take out right before you go home. They'll also have some of the home health available sometimes to help with removal of the pain pump. As far as physical therapy at home, it'll be a continuation of the program that you started in the hospital. Part of this is surgeon directed. Also part of it is dependent on what type of procedure that you had, whether it be a regular total shoulder replacement or a partial shoulder replacement or a reverse total shoulder replacement. You'll be given instructions on what you can do and not do at home, and the physical therapist will also be directed on what you can or can't do at home. In the hospital, they'll see you a couple times and go over hand, wrist, and elbow motions with you. If you've had a shoulder replacement, they'll start some gentle range of motion exercises that are passive, meaning the therapist is moving your arm, you're not moving your arm yourself. This will continue at home through the home physical therapist or through an outpatient program where you'll go to a therapy place to have physical therapy. If you've had a reverse shoulder replacement, usually the therapy will be limited to the hand, wrist, and elbow. We don't do much motion with the shoulder during the first 4 weeks because we like the tissues around to heal and to kind of tighten up to decrease any chance of the shoulder slipping out of place at home, which is a rare complication. Once you're seen in follow-up in the office, if you've been having home physical therapy, you'll be given a prescription to continue this more on an outpatient physical therapy program. This can be done at ProAxis, where we have a good affiliation with them. They have all of our protocols and they know what to do with our patients and what we expect outcome-wise. If you live further away, certainly we can arrange for physical therapy to be done closer to a place closer at your home, and we'll take care of getting all the instructions to them. As far as concerns about things not progressing right at home, the only 2 or 3 things that we worry about or look for that would be out of the ordinary. One would be signs of an infection. An infection is rare, only occurs 1 to 2% of the time. Usually signs of this will be 4 or 5 days or even longer afterwards that you'll develop increased redness, pain, and swelling in the surgical area, occasionally some drainage from the surgical area, and occasionally a small part of the wound will open up. If you develop any signs like this, it's important to contact us, and we'll address these and let you know what we need you to do. Also, signs of infection can be fever, sometimes chills, night sweats, or just feeling bad. The other thing that we worry about occasionally is a blood clot. A blood clot is just a rare complication from surgery where the blood in the lower legs, or sometimes in the upper extremity or the upper arm, slows to a point where the blood forms a clot in the vein. This can be troublesome. Most of the time it's found by swelling in the extremity, either the leg or the arm, that doesn't resolve with elevation or is not getting better after the expected time from surgery. You can also have tenderness in this area and sometimes increased pain as well. Usually you'll be sent home on something to decrease the risk of blood clots. Most of the time it'll be TED hose, which you wear on your lower extremities anywhere from 2 to 5 days, depending on the instructions at home that you're given before you go home. And also you may be given a medication. This can be aspirin, which you would take once or twice a day for a period anywhere from 7 to 10 days to sometimes a month. This all depends on risk factors that you have compared to other patients, and these the duration of the medication and the dosage will be written on your discharge orders, and that will be gone over with you prior to your leaving the hospital. Occasionally, if you're at high risk for a blood clot or higher risk than other patients, you'll be put on a different medication, and this may be one such as Lovenox, where it's a injection that usually you give yourself at home in the skin, in the abdomen, and that thins the blood more than the aspirin. And again, that'll be arranged prior to your discharge. As far as activities at home, after a shoulder replacement surgery, you should be able to ambulate fairly well. Usually you'll be able to get up out of bed the day of surgery in the hospital or the day after surgery in the hospital, and we'd like to continue mobilizing you at home, meaning we'd like you up out of bed as much as possible, going to the bathroom, eating your meals out of bed. All of this gets the body back to more of a normal function and can help prevent some of the problems such as a blood clot in the lower extremity. Usually you'll be placed in a sling or a type of shoulder immobilizer such as this one. This has a nice comfortable pillow that sits on the side. One of the straps goes around your neck, and then you have one strap that goes around the body. This is to help keep the shoulder comfortable, to allow the tissues to heal in the postoperative period, and also to keep you from doing maybe too much at home, maybe reaching when you shouldn't be reaching, and most of all, it's just to allow the wound to heal and to allow you to be more comfortable. This has a squeeze ball in this one that can be taken out and just played with throughout the day. What this does is help get the blood circulating through the hand to keep the swelling down in the extremity. You'll also be instructed at home on how often you can take the sling off and how often you can come out of the sling. This will be done but through physical therapy, and also once you're comfortable, you'll be able to do this on your own, and you'll work on some of the motions at home on your own. You'll be able to use your hand and your wrist to do things such as a computer and light activities. Most of the time you'll be able, when you're more comfortable, to eat with this arm, because moving the arm up and down mostly is just the elbow, and the wrist and the shoulder can stay fairly quiet. One of the most popular questions afterwards is when can I drive again? Usually we'll see you back in the office at about a week or 2 weeks after surgery. Usually we wouldn't want you driving before this time. We want to make sure that you're comfortable, everything's going well. Want to make sure that you're not taking pain medications when you're driving to be safe, and also want to make sure that you have enough control of your extremities, mostly your arm and your other arm, that you can drive safely without injuring yourself or getting in a situation where you can't react safely. So driving is different for everybody. Usually it's somewhere down the road, a period of 2 to 4 to 6 weeks, depending on how you drove before, how well you drove before, how well you're recovering, and how quickly you can get off the pain medications. But again, driving mostly is when you can safely drive a vehicle and you're not on pain medications. Hopefully this video has been helpful to you while you're here in the hospital. Hopefully you're getting more comfortable and progressing well. Again, this video is designed to help you with the transition from the hospital to home and to answer some of the more common questions that you have. We're available anytime that you have a concern. Somebody's always on call. Usually somebody's in the office as well. If you just call the phone number 864-454-7422, they'll get in touch with us and we'll get your questions answered. I look forward to seeing you on your first follow-up visit.